this is the, I think, 5th episode of the ATCP 72 Rule Revision Advisory Committee. Again, for those just tuning in, I'm Ted Tucholsky, the Environmental Health Technical Specialist for DACCAP for the Lodging and Campground Programs. On today's agenda, we have roll call to start out, followed by public appearances. I did not receive any emails from people wishing to speak, so we can skip over that unless there's someone here that we can get to. The provisions we're going to be talking about are going to be the health and safety standard, water supply, sewage, and we may get into the beginning parts of building structure and safety depending on how the day goes. But for sure, we want to get through 1, 2, and 3. And then just a reminder for upcoming meeting dates, the last Tuesday of every month. So we have March 26th, April 30th, and May 28th. So we'll go through with roll call. So I'm here, and Greg.
Present.
Amy.
Here.
Christy. Lori. Emily. Alyssa. Brandon. Corey. Craig.
I'm here.
Jason.
Here.
Jim, you're here.
Yep.
Jason Hager.
Here.
Trista.
Yes, I'm here.
Okay. Bill.
Here.
Andy. Jumani. And Dave Bond.
I'm here.
Okay.
I see
And
Corey's here too.
Corey is on. Okay. And Reed.
Present.
Mary Ellen.
Here.
And anyone else that I did not mention. Looks like Linda, you're on our returning special guest. Welcome back. So with public appearances, it doesn't sound like anyone has anything that they wish to bring to the committee. I did not receive anything ahead of time, like I had mentioned. So we'll move on with kind of our overview timeline. Obviously, we've gone through a good chunk of this, but now we're getting into the meat and potatoes of provisions that are going to directly affect the operation of a lodging facility and the maintenance of it. Before, the stuff that we've covered has been a fair amount of redundancies, with the exception of definitions, obviously, with the other administrative codes that we have at DACCAP, being the rec ed camps and pools and campgrounds. So now we'll be getting into specific items concerning lodging. So we should be able to get through like I said, the 15, 16, and 17 sections. And then we can possibly get ahead of schedule by dipping into the building structure and safety. So we are still on schedule and possibly ahead of schedule depending on how things go today. And then we do have the 2 outliers on there, June and July. Specialty lodging, we did meet with DSPS to kind of float that idea out there on whether this is something that can be done or not. We're still waiting to hear back on their initial thoughts on that. And then special event lodging, still haven't discussed that a whole lot more, but I don't know that will actually develop into anything. So before we get into actual code language, I wanted to not necessarily do a picture show here, but kind of re-jog your memory of some of the things we will be talking about, or to give a little bit more reference before we just get into the language and jargon. So we'll start out with potable water and wastewater systems. And these are true pictures that I have received of lodging facilities. So there's some interesting ones. But the first I want to talk about is public versus private water systems. So we have typically three different type of systems that we see in a lodging facility. Uh, Probably the most common is the municipal community system. So that is public water system. It's going to be any town, Wisconsin, providing water to the residents or businesses. So your downtown hotel that's on water, they're probably going to be getting this type of system. The other public water system is the transient non-community or TN system. These are wells located on premises serving at least 25 or more people on 60 or more days during the year. So this might be a motel on the outskirts of town that has a well, and that's where they're getting their water from, but they serve a diverse group of people, so at least 25 or more, and then they are serving for a decent length out of that year, so more than 60 days out of that year. They're going to be considered a public water system and will have additional requirements from the DNR to follow. A lot of times the local health department will also serve as the agent for the DNR in addition to the agent for DACAP. So they will, you may have a health inspector that will collect water samples, and then they'll also do the hotel inspection while they're there. They're working under um, the the contract of two different departments. So that's the other type of public water system that we typically see. And then we have our private well systems. So this is mostly going to be your tourist rooming houses that are on a well. So it is a well located on the premises serving less than 25 people or serves 25 people, but for less than 60 days. So a tourist rooming house isn't going to have generally 25 people or more in it. It just doesn't have that capacity. So one of the problems with private wells versus public wells is that the private systems, they're regulated, but they don't necessarily, you don't necessarily have to abide by the same drinking water standards that are in NR 809. And the problem being we have tourist rooming houses that are on private well systems, and they don't have to meet that standard. So you could have, high nitrates, for example, and there's nothing. You can drink high nitrates on your private well. There's no repercussion on having that. So we want to bring in the standards of public systems that our hotels and motels have to follow and apply that to our private systems as well. I think it really evens the playing field, and also people coming in to visit the state should be assured that they're drinking safe water. So the two annual requirements that we're proposing are total coliform and E. coli. So total coliform is a general grouping of bacteria. If you have total coliform in your well, there's an indication that somehow the environment from the outside is getting into your water system. So it's an indicator test to let you know that there's something wrong with the system there. If a total coliform test comes back as positive, the lab will automatically go and test for E. coli. E. coli is going to be a pathogenic organism that you do not want in your system. So it's a test for that total coliform, and then an E. coli if needed. That's about a $35 test if you're using the Wisconsin Lab of Hygiene, and this is on an annual basis. So same thing that our public systems are already doing. The other test would be a nitrate test. So concerns with nitrates, they can cause blue baby syndrome in infants. They may also increase the risk of certain birth defects, thyroid disease, or other certain types of cancers. So the take action threshold for a nitrate is 10 milligrams per liter. The DNR currently has, if you're in a threshold between 10 and 20 milligrams per liter, you can post a consumer notice alerting the people that are consuming that water that this has elevated risk. If you're at risk of, or if you're pregnant or may become pregnant, or you're filling up children's baby bottles, you should use a different water source is essentially the gist of that messaging. And then once we exceed 20 milligrams per liter, that's basically declared an unsafe drinking water source, and no one should be drinking that. Again, this test is $35 through the Wisconsin Lab of Hygiene, and would be performed annually. So those are two proposals that we're looking to put in the language, and we'll get to that too. We'll also be talking about pout systems. So we defined this in our first meeting or second meeting that we had, but I, again, just wanted to jog your memory on what a pout system is. And that is a private on-site wastewater treatment system or your home septic system. This could also be at a larger facility, may also be on a pouts. Hotels and motels can be too. But they're typically going to be when in a rural area where you don't have a municipal hookup. So it consists of a settling tank or a holding tank that then gets pumped out to a drain field, and the wastewater percolates down through the soils and then back into the groundwater, and it's should be filtered at that point and good for consumption. Next, I just want to talk a little bit about waterborne diseases and outbreaks. So the most common waterborne disease that we encounter in lodging facilities is going to be Legionella, and I'll get into what it is and how it affects people in a second. But over the course of, we have here 7 years or so, there's only been 13 investigations, which doesn't seem like a whole lot. Maybe only 15 illnesses, but unfortunately 1 death out of this. And the key takeaway from why we're bringing this up is that it is a preventable disease. There's standards and literature out there on ways to prevent this within a building, and we want to bring that into code so that we don't have to have any more investigations or illnesses or deaths. That ideally this would be a graph of nothing because it is a preventable disease. So I'll go into what exactly it is and how you actually acquire a Legionella infection. Like I had said, it is a waterborne bacteria. There's roughly 60 species out there. A third of them are infectious. And then within those species, there are 70 plus serogroups, which are essentially varieties. And the most common to infect humans and to cause Legionnaire's disease is Legionella pneumophila serogroup 1. So it naturally occurring in freshwater environments, but that's not necessarily where people pick it up. It will get into the built environment, and that's where it will fester and amplify and grow. So we tend to find it in potable water systems, specifically hot water, whirlpools, water features such as like a water fountain or those walls where it's got water cascading down it. And then lastly would be cooling towers. Cooling tower is more of an industrial type of equipment. It's going to be on larger resorts or hotels, conference centers, something like that. Not necessarily on a tourist rooming house or not on a motel, generally. So the contaminated water is within the building. It is then dispersed through various ways. The main mode of transport is aerosolization. So it's going to get sprayed out through a shower head, the hot tub jets or whirlpool jets, even fill and drain tubs, jacuzzi tubs that you have within rooms that can also aerosolize the bacteria, and then also water fountains or spray features. From there, it is more commonly inhaled through the body, and it gets into the lungs. It's a pneumonia, the Legionnaire's diseases. And a less common way of getting it is aspiration. This can happen more so in a hospital setting where someone may be restricted to ice chips or something of that sort. And then they choke or aspirate on those contaminated pieces of ice that they're eating. that too can contribute to receiving the infection. So the risk factors for Legionnaire's disease are individuals that are 50 years or older, they're current or former smokers, they may have a chronic lung disease, or they are immunocompromised. Those are the individuals that are most at risk. Pontiac fever, on the other hand, is really anyone susceptible to it. So Legionnaire's disease is the deadlier of the two. It has a fairly small attack rate. It's less than 5%, but it has a high fatality rate of greater than 10%. So if you've got 10 people with Legionnaire's disease, there's a good chance at least one of them won't survive from it. Again, it's more of a pneumonia disease. It's affecting the lungs. Pontiac fever, on the other hand, it's more self-limiting, or it is self-limiting. It doesn't require any hospitalization. Fever, severe body aches kind of occur within 72 hours of coming across the contaminated water, and the fatality rate is less than 1% or almost zero. So the body is able to fight this one off, and there's a little less data associated with it because you don't have people going to the doctor to get tested. So the information surrounding it is a little more cryptic. But when we have waterborne disease outbreaks, and an outbreak is defined as 2 or more unrelated cases within a 12-month period. So the Department of Health and Department of Health Services and their epidemiologists are surveying the health data, and they will notify us if there are 2 or more cases, and the only commonality is a specific, hotel or tourist rooming house or whatever it may be. It could even be a pool. We receive that notification. The health department or DACAP will go out and conduct an environmental assessment. They may take some samples. If we end up finding the bacteria or disease that we got the notification for, we would issue some type of compliance orders closing that room or that whirlpool or whatever it may be. The facility would then be tasked with remediating it. The health department or DACAP would then test to verify that it's been taken care of, and they would get the room or whirlpool released, and we would carry on. For a Legionella outbreak response, we're doing very similar procedures. We've got the 2 or more unrelated incidences. We get notified. There's an environmental assessment and sampling. We tend to focus on the hot water systems, the hot tubs, the decorative fountains. There's a CDC environmental assessment to follow that guides you through the building. Again, if it comes back positive, we're issuing compliance orders. The facility will remediate, and then DACAP or agent will sample in those places that came back positive to verify that it's been removed. And then our proposal is, in addition to that they create, the facility is tasked with creating a water management program to essentially prevent this from reoccurring. The water management program is a risk management plan for the prevention and control of Legionellosis, and that's associated with the building water systems. So right now, the standard that CDC is hanging their hat on is the ASHRAE ANSI standard 188. That's currently the gold standard for following and preventing Legionella in your specific building. So what it consists of, it's very similar to a HACCP plan, if you're familiar with that, and in the restaurant world. But the 7 principles for a water management program, there's a team. It can be usually your chief engineer, maybe someone from the health department, maybe a consultant. There's no set prescription on who has to be on that team, but you want people from diverse backgrounds. 2, you're creating or describing the building water system using words or diagrams. You're identifying areas where Legionella could grow. So like I had said, the whirlpool, the hot water heaters, the hot storage areas, things of that sort. You're deciding where control measures should be applied and how to monitor them. You're establishing ways to intervene when control limits are not met. Making sure that the program is running as designed and is effective, and then documenting and communicating all the activities. That's kind of the main principles of a water management program. So from there, I want to, this will be part of the building maintenance portion. So we may not get to this until the next meeting, but if we do, I just want to kind of set the stage for this. So slips, trips, and falls is something that we want to address in the current code. We've addressed it through guidance documents. This diagram in particular is in our lodging inspection guidance. It is bringing forth handrail requirements. So within 30 and 38 inches, there should be a handrail on stairs. The guards are these vertical slats here. We don't want to see gaps greater than 6 inches. And the reason for that is children can possibly get their body through, but their head may get stuck and not actually allow their whole body to pass through if it's too big of a space. So 6 inches is what we're saying. You can't get too larger than that. On an elevated surface, like a deck or a balcony that's up off the ground, this would be a 36-inch height on those guards, and then again, no more than the 6 inches. And then this is something that, again, is already in our inspection guidance, but we're looking to codify that. And sleeping rooms. So we want to address ceiling height, egress concerns, capacity, and bunk beds. So we see an array of configurations, obviously more so in a tourist rooming house. There's some questionable designs on getting people to sleep in various rooms. And this is less so of a problem in a motel or hotel. So with that, we will switch over to the code language. Are there any questions from what I've presented so far? Okay. So we'll switch gears here.
Yeah, just let you know, Chrissy joined late.
Yes, I did see that. Thank you. All right. The Word document should be available or viewable now. So we'll carry on with that. Subchapter 5, general
Can you make it-
provisions.
Can you make it a little bigger, Ted?
I sure can. How's that?
Good.
Good. All right, section 15 here, health and safety hazard, or health and safety standard. Pursuant to state statute 97.62, every lodging facility shall be operated and maintained with a strict regard to the public health and safety. Section 16, water supply, water systems, and plumbing. It's just a goofy space. Okay. Number 1, water systems. General, the water source used to supply a lodging facility shall be a public or private water system. B, well construction. The operation, construction, installation, materials, and maintenance of the private water system used to supply water to the lodging facility shall comply with the well construction standards as enforced by the Wisconsin Department of Natural Resources. Note, for more information regarding well construction standards, see Chapter NR 812. C, location. Except as provided in paragraph D, the private wells shall be located on the premises. D, shared private wells. If the operator of the lodging facility shares a well that is not located on the premises, the operator shall provide a signed written agreement detailing the physical location of the well and the parties responsible for maintaining the system. Two, potable water supply. A, drinking water standards. A lodging facility's potable water supply shall meet the groundwater quality standards in Chapter NR 140 as enforced by the Wisconsin Department of Natural Resources. So within NR 140 is contaminant A through Z. It's a long list of potential contaminants. We're not requiring testing of those, like I had mentioned, and we'll get to just total coliform / E. coli and then nitrate. But we didn't want to necessarily leave this out in case someone did test for, say, arsenic, and it had exceeded levels. We didn't want to be hamstrung and not be able to kind of intervene when we know that someone has a unsafe water result. So that's why this portion was put in here. In the notes for public drinking water well data visit, that website. B, availability, except as specified under paragraph D, each lodging facility shall be provided with a potable water supply under pressure. C, water temperature. Hand washing sinks and fixtures used for bathing shall be equipped to provide a water temperature of at least 85 degrees Fahrenheit through a mixing valve or a combination faucet. I'm still, and I'll take feedback on this, I'm still kind of wishy-washy on the water temperature. I initially wanted to put in language to prevent scalding, so not to exceed, I think it's 130 degrees or 125 degrees at the faucet. I had proposed that language in the initial draft, and I had sent it to another department for review of the language, and they took it as the water cannot exceed 125 or 130 degrees throughout the whole system, and that's definitely not what we want to do. Thermal disinfection is one of our safety hurdles that we can use within a building. So I didn't want that to come across. The main thing we're getting here with the water temperature is that there needs to be hot water supplied within the facility, and the 85 degrees is pulled from the FDA food code and Wisconsin food code. That's their minimum for hot water is 85 degrees, at least at a hand washing sink. So that's where that comes from. D, temporary water service disruptions. When a lodging facility has a temporary interruption in the water supply, guests of the lodging facility shall be informed, and any one of the following methods may be used to provide potable water. I have an alternative form for that, and I'll take feedback on which you prefer. The alternative is the operator shall inform guests of any water service disruptions to the water supply and shall provide potable water using one of the following methods. Any preference on one of the two versions? Okay. So the methods that can be used to provide water are commercially bottled drinking water, an enclosed vehicular water tank, or other methods approved by the department or its agent. E, private well water testing, bacteriological. The operator shall have bacteriological analysis performed for total coliform and E. coli consistent with the approved testing methods pursuant to ATCP 77. And I put a note in here to put in the genus Escherichia and then parentheses E. coli, so we can use that throughout the rest of it. I thought it was consistent with what we're doing for Legionella. 2, total coliform and E. coli analysis shall not exceed 0 colony forming units pursuant to NR 140.10. F, private well water testing nitrates. The operator shall conduct nitrate analysis consistent with the approved testing methods pursuant to NR 149. 2, the analysis of nitrate concentration in the well water shall not exceed 10 milligrams per liter. pursuant to NR 140.10. 3, if the analysis of the nitrate concentration in the well water is between 10 and 20 milligrams per liter, the operator shall post a drinking water advisory signage as provided by the department or its language or agent. B, in all areas where drinking water can normally be obtained. 4, if the analysis, I got a question from Trista. You can unmute yourself too, that's fine. Correct me if I'm wrong, the ATCP 75 appendix indicates minimum water temperature of 100 degrees at hand washing sinks.
The 22 food code is moving it to 85 degrees.
Okay, I wasn't aware of that. Do you know when we're gonna see that change though, Jim?
As soon as we get a chance to open up the retail food code.
Okay,
Hopefully a scope statement sometime in the fall.
good to know. Thank you.
Thanks for that feedback. All right, I think we're on 4 here. If the analysis of the nitrate concentration in the well water exceeds 20 milligrams per liter, it is considered an unsafe potable water source and shall follow the requirements under paragraph H3.
Ted, quick question for you.
Yes.
Are there add-on plumbing devices, treatment devices that you can add, say a sample of 22 milligrams? Is there something you can put in your water system separate from drilling a new well?
Right.
Will,
Yeah. Cheaper options? Yes, there are. There's point of entry and point of use treatment methods. And I believe reverse osmosis is probably the most common to remove that, a nitrate contamination. So yeah, there are different ways to do it. Kind of the messaging is consult a plumber, essentially, on the installation of it. The Department of Health has a handout and table that says, here's your contaminant, here's your treatment system, here's which ones line up, and we'll take care of that. So for example, the reverse osmosis will take care of nitrate.
thanks, Ted.
Mm-hmm.
Ted, do we have any provisions for timing of seasonality? Because nitrates vary greatly throughout the year.
Right. There isn't. We're getting into that, but it's just to perform it every 12 months.
So the only issue I have with this is if we're talking about the risk, that the risk for high nitrates is to fetuses and newborns, right?
Mm-hmm.
So it doesn't really
Correct.
pose a risk to adults or children. And the science behind it is it has to be prolonged exposure. If you're talking about people going to a tourist rooming house for 7 days, you are not going to cause any issue to the fetus or to an infant in that period of time. It's prolonged use. It would be for someone who lives in a house with a well with high nitrates and drinks it every day their whole pregnancy. So we're kind of imposing a standard on a very small exposure based on annual testing that you could get a peak if your health department decides to test you at the spring thaw or after fertilization. There's so many variables. Now you could be artificially elevated or artificially low on
Sure.
your testing. So what's the common sense behind this other than it seems more reactionary? We should really be, if we're worried about health of fetuses and infants, we should be doing this for residents more than tourist rooming houses.
Yeah, so the DNR currently requires this for transient operations, like your gas station. So even if a gas station had high nitrates, obviously no one's living there or consuming that water consistently unless they're an employee possibly. There is a requirement to post in excess of 10 milligrams per liter for the off chance that maybe someone goes in there and fills that baby bottle up. That's, according to the DNR, enough of a risk to warrant posting of a notification. So the idea here is to be consistent with that. That transient.
And I get that. Yeah, I get that. I'm not trying to be obstructionist about it. I'm trying
No,
to
that's
be,
fine.
I have a medical training, so I'm looking at this from, the DNR might say this, it may not make sense. So are we gonna perpetuate a standard that doesn't have any medical basis to it into yet another arena? Or is
Sure.
there room for discussion to say, well, hold on, this doesn't really apply here. This doesn't really make sense, and we're not really protecting anybody. Because the problem is, if we say to the people that are staying at a tourist rooming house, hey, we've tested for nitrates, you're just fine. And in fact, we tested before spring thaw and the nitrates were low and now they're 30.
Mm-hmm.
We've not protected those people at all. So that's my issue, is we're getting into standards that don't have scientific basis to it. So is there at least room in the provision to say that it can be retested later in the year or at a different time? Because we know those nitrates are going to vary drastically.
Right. And that can be added in. That's, anything's on the table here. I'll put it that way. So I appreciate the comments, and I get what you're saying, and that's the reason why we didn't put radon. Same idea.
But if you're not going to put radon, why are we putting nitrate?
Right. I get what you're saying. Yeah, you're saying there's a dosage and length of time that you're receiving that dosage before the
It's
concern
an
kicks in.
exposure. Yeah.
Yeah.
Having water with high nitrates for 1 week is not going to cause any issues at all. That's well documented.
Any other comments to go off of that, whether in favor or against?
Hey Ted, this is Bill Elliott.
Yes.
I'm sorry, I'm on the phone, so I can't see the screens today as I'm driving. But I'm curious. Right now, are we testing private wells at all for tourist rooming houses that are licensed?
The only thing we're requiring is that time of licensing to have a total coliform / E. coli test. That's it.
Okay,
Annually.
thank you.
It's not annual yet. In 73, the bed and breakfast code, it requires annual. In 72, it does not require annual. Maybe
it's a county thing. We have two of our counties. I'm in 2 counties, and they both require annual testing.
Do they? Yeah. Obviously, we are looking to add that in, an annual. And like you said, it is a snapshot. You're at a higher risk of getting a total coliform positive in summer than you are in winter as well. So yes, there is some sampling error or seasonality to it. I agree with what you're stating.
Could we consider something like alternative frequency of sampling for some of those other things like nitrate or arsenic, like every 5 years or something to that effect? Because even if it is just a private residence, if we're just talking TRHs,
Yep.
You're still renting it out and you're still operating it like a business. So you still would have some obligation to provide a safe drinking water source, just like any other business would. And I know public drinking water systems have to comply with certain standards for that. I don't know, something to maybe open that conversation up a little bit.
Sure. Any other thoughts or feelings on nitrate? Okay. So we're on G, private well water testing, frequency, location, approved methods, and notification. 1, the operator shall test the water from a private well at least once every 12 months. 2, the water sample shall be obtained from a faucet regularly used by tourists or transients. 3, private well water testing shall be performed by a Wisconsin Department of Natural Resources Drinking Water Certified Laboratory. 4, the department or its agent shall be notified when A, the bacteriological test results for E. coli or total coliform exceeds 0 coliforming units as specified in paragraph E2. And B, the nitrate test results exceed 10 milligrams per liter as specified in paragraph F2. Note, bottles for collection of water samples may be obtained by writing to the Wisconsin State Laboratory of Hygiene or by calling their phone number. And second note, to find a list of Wisconsin Department of Natural Resources drinking water certified laboratories, visit the website listed. H, unsafe potable water. Pursuant to ATCP 72.15, all lodging facilities shall be operated in strict regard to public health and safety. 1, the operator shall discontinue use of a private water system used to supply water to a lodging facility whenever the potable water for the private water system does not meet the bacteriological safe requirements under parent E2 for the presence of E. coli. 2, the operator shall discontinue use of a private water system used to supply water to a lodging facility whenever the potable water from the private water system does not meet bacteriological safe requirements under parent E2 when total coliform is positive on 3 consecutive well water samples. 3, the operator shall discontinue use of a private water system used to supply water to a lodging facility whenever the potable water from the private water system does not meet nitrate levels requirements under parent F4, which is the 20 milligrams per liter. 4, the operator shall discontinue use of a public water system used to supply water to a lodging facility whenever the potable water from the private water system does not meet safe drinking water standards pursuant to NR 140.10. And that's that chart of A to Z contaminants. Any further discussion on total coliform, E. coli, nitrate, testing frequency, locations, any of that, besides reviewing the nitrate language and I can look more into the actual risk of that, or get the DNR's perspective from it and bring that to the group too.
Ted, quick question for you.
Sure.
Does the version of the rule we're looking at now allow for properly installed hand pump well that produces safe results? Or aren't we to that section yet?
Not to there yet.
Okay.
Yeah.
Thank you.
That is the notion we're looking for when it comes to a specialty lodging. So that's your conceptually, it's your primitive housing that does not necessarily have electricity or plumbing or all the required plumbing fixtures within it, but it will have potable water somewhere on the premises. And it might be that hand pump well.
And that was
So-
a discussion for the summer, I think you said.
Yeah, that's gonna be a little bit further.
Okay.
It's the initial response from DSPS on how feasible that is, or their professional opinion on it, since they are the tradespeople. Still waiting to hear back on that, but that is the intent to offer something like that for an alternative lodging. Okay, number 3, waterborne diseases. So A, health department notification. The operator shall contact the department or its agent for operational and testing guidance when notified of a suspected waterborne illness. B, suspected waterborne outbreak investigation. Pursuant to ATCP 72.091A, as part of the investigation or inspection, the department or its agent may secure water samples for analysis. C, confirmed waterborne outbreak. A lodging facility that has a waterborne illness outbreak, as confirmed through laboratory analysis, shall complete all of the following. 1, prevent continued exposure by implementing any of the following methods. A, immediately discontinue public access to affected fixtures, equipment, or areas. B, install point-of-use water treatment filters. C, other safeguards approved by the department. D, a combination of sub D paragraph A, B, or C. 2, develop a written remediation plan that includes all the following. A, identifies the source of the waterborne pathogen. B, identifies locations affected by the waterborne pathogen. And C, the method that will be used to remove the pathogen from the location specified in A and B. 3, execute the remediation plan. 4, collect post-remediation samples at least 48 hours after the execution of the remediation plan for the locations identified under 2A and B. So there's generally a gap between doing the treatment and confirming that the treatment was successful, just so you aren't necessarily getting a false or a false negative. Some of that bacteria can get knocked down, and then it can start to regrow after that initial shock treatment or heat treatment or whatever the method was. So this allows anything, if there is still survived, that has survived, to let it regrow, and then you do your testing afterwards to truly confirm if it's there or not. 5, obtain approval from the department or its agent to resume normal operations in affected areas. 6, if the confirmed waterborne outbreak is associated with Legionella species, the lodging facility operator, in addition to the requirements in parent C, shall complete all the following. A, notify incoming guests and staff about the possible exposure to Legionella and symptoms of Legionnaire's disease and Pontiac fever until the operator has received approval from the department or its agent to resume normal operations. B, notify guests from the previous 14 calendar days of the confirmed waterborne outbreak in writing as approved by the department about possible exposure to Legionella and symptoms of Legionnaire's disease and Pontiac fever. C, develop and implement a water management program in accordance with ANSI ASHRAE Standard 188, Legionellosis Risk Management for Building Water Systems. And D, sampling validation shall be conducted at an elite certified laboratory in accordance with the frequency established for sampling under sub D par C. And note, laboratories can test their Legionella isolation techniques against standardized samples through the Environmental Legionella Isolation Techniques Evaluation, or ELITE program. Participating labs receive a panel of lymphocyzed test samples twice each year from the Wisconsin State Laboratory of Hygiene. Some of the test samples are Legionella positive and some are Legionella negative. The test samples may also include other organisms commonly found in water. Participating labs process the test samples and report the results. Those labs that correctly identify Legionella in 2 consecutive panels receive documentation for passing the proficiency test. I did put a note in here for the specific call out to ANSI ASHRAE standard 188 Legionellosis risk management. Like I said, this is currently what the CDC hangs their hat on and has a slew of information and guidance documents and forms and everything else revolving around this standard. However, the one I see good and bad by putting this in here. Good thing is you have a standard to go to, you know what the expectations is. The problem with keeping it generic and removing this and just simply stating develop and implement water management program, the concerns is now, well, what does that mean? That doesn't really help anyone just reading the code. However, the benefit of keeping it generic is as, and we know as technology and information moves forward, sometimes these standards are replaced. You know, this could get, maybe there's a new standard that comes out that is more current with current information than this standard 188. So I don't necessarily want to get stuck with this old antiquated standard in 5-10 years because it's locked in code here. So I'm curious on what your reaction is to that, with the specific call out standard versus something generic like having a water management program.
That I think we could say something like develop and implement a water management program as approved by the department.
Okay.
That would allow us to say, really the only one out there right now is the ASHRAE standard, or if there's other ones that get forwarded to us, they can be reviewed and approved.
Okay. Any other gut reactions or thoughts on that? Okay, we'll move on here after I italicize that. All right, number 4, plumbing. A general, all plumbing shall comply with the requirements of the State Uniform Plumbing Code as enforced by the Wisconsin Department of Safety and Professional Services. B, backflow prevention design standard. A backflow or back siphonage prevention device installed on a water supply system shall meet standards for construction, installation, and maintenance. C, air gap. When an air gap is required, the distance of the air gap shall be at least twice the diameter of the water or waste piping. All right, section 17, sewage disposal system. 1, sewage. Sewage, including all liquid and water carried wastes from plumbing fixtures, shall discharge into a public sewer or private on-site wastewater treatment system, or POUTS. 2, POUTS disposal. A, designed, constructed, and operated. Any POUT system used by a lodging facility under this chapter shall be located, designed, constructed, and operated in accordance with the State Uniform Plumbing Code as enforced by the Wisconsin Department of Safety and Professional Services. B, POUTS covers, access covers. The operator shall ensure that the access opening covers to a POUTS are locked or secured to prevent general access by the public except for inspection, evaluation, maintenance, or servicing purposes. Three, failed sewage disposal system. A non-functional public sewer or a failing POUTS as determined by the Wisconsin Department of Safety and Professional Services, their agents, or the local zoning authority shall be brought into compliance, replaced, or its use discontinued. 4, toilet facilities. A, private fixtures. Except as specified in B, an individually keyed unit shall provide a minimum of one toilet, one sink located in or adjacent to the toilet room, and a shower or bathtub. B, shared fixtures. 1, a hostel or an existing lodging facility that does not meet the requirements under paragraph A shall provide a minimum of one toilet, one sink located in or adjacent to the toilet rooms, and a shower or bathtub for every 10 tourists or transients or fraction thereof. 2, all toilet stalls or rooms shall be provided with a privacy lock. And 3, in an owner-occupied lodging facility, the owner or operator shall have their own toilet facility separate from the toilet facility provided to the tourist or transient. C, alternatives to water-carried waste. Portable toilets, composting toilet systems, incinerating toilets, and privies shall comply with the requirements for alternatives to water-carried waste plumbing fixtures as enforced by the Wisconsin Department of Safety and Professional Services, their agents, or local zoning authority. Note, for more information regarding alternatives to water-carried waste plumbing fixtures, see section SPS 391.
Hey, Ted, if I could take and jump in, this is Jason.
Yes. Please do.
And that the local zoning authority, we've got it right there in provision C, and we've got it up
Yep.
a little bit. I'm thinking some counties in that are handling their septic program through the health department. So maybe it'd be local government authority.
That's why we put in their agent. DSPS
Right.
agent.
Or the local zoning authority.
Yeah.
It's just an idea that it's not every county is using their zoning authority for their POTS program. So
say again, your
so after their agents there or
Yep.
the local zoning authority, I think it could be local governmental or government authority.
Okay.
Just to include
zoning and
some
health.
of the counties and zoning and health. Yep.
Yep.
Depending on where those staff fall at the county level in what department.
Sure. I saw Linda's just chimed in with county sanitarian. Also a possibility. Okay.
Yep. Yeah, that would be fine too. So, yep.
And where else was it in here? Oh, there it is. Okay. Want to make sure.
I think local governmental authority would include any governmental body that would do it.
Right. Yeah, and Jason, does DSPS do any of this, or is it delegated to all counties?
It's delegated except for some of the plan reviews on some of these more commercial systems. Those can be done at the state, but otherwise all the enforcement, permitting, and inspections are done by the local governmental unit is what the code actually refers to as. So governmental authority, governmental unit, it'd be
Okay.
fine.
Okay.
That'd be an SPS 383. So.
All right, thank you. D, soap and towels. Each toilet room shall be provided with soap, single-use towels, or single-service towels or other approved means for drying hands, and an adequate supply of toilet paper. I'm just thinking you could have an air dryer instead of towels, so I don't know that I like towels on there. Maybe
Well, we say
change the hiding on that.
other.
Go ahead.
We do say or other approved means of hand drying.
True. Yeah, we do allow an air blower. It's just, I don't know if the towels makes it feel like you have to have towels, which is not the case. E, waste receptacle. Each toilet room shall be provided with a waste receptacle. F, slip-resistant flooring in showers and bathtubs. Slip-resistant flooring or materials shall be provided in all shower and bathtub basins. Note, approved slip-resistant flooring or materials include grouted tile, anti-slip tape, bath mat, or textured surface. Okay, that takes us to the end of the plumbing. Are there anything that rubbed you the wrong way in regards to sewage, waterborne diseases, testing of water? Obviously, we have follow-up on the nitrate to get more information on that. And I can bring that to the group next time. But
Ted, this is Dave.
yes.
The hand washing, the bathroom,
Mhm.
the last one we talked about.
Yep.
Single-use towels. I mean, typically we're talking about, these are families that are coming together and they have hand towels like you would have at your house
Yes.
to dry hands at the sink. Is that no longer going to be acceptable?
No, that's fine. We can add in linens or something of that.
Yeah.
Yeah, no,
Single use
that's
makes
still
it sound like
expected.
we're going to have a stack.
Yep.
Okay. And then
No.
the toilet paper, typically what we do is we give a fairly large supply of toilet paper for a group in each bathroom, but we don't, it's not a bottomless supply for them, no pun intended.
Right.
So we're advertising that we're getting you started. We're giving you what, most people will go through in a week.
Mhm.
But if you run out, you've got to go get more on your own.
Right.
Is that
And-
not
and
going to be acceptable?
Well, so Jim and I talked about what is an adequate supply. And it was, can we just leave it as adequate, or do we have to define what we're expecting here? I don't know, as a typical consumer, if I go into a lodging facility, there's usually what's on the roll and there's an extra one sitting there. To me is kind of the adequate supply for that time. Obviously,
Yeah.
it's gonna matter on how many, are they at full capacity in that tourist rooming house, or is it just a couple? How long are they staying? Obviously, that all varies. But any other concerns with this adequate supply term? Dave, what's your possible solution to this?
Well, I think that the way we word it in our facilities is to say that we will provide you with an adequate supply of toilet paper, but if you run out, you're required to get more on your own. We're not going to come over and restock it.
Okay.
We're talking, we're probably leaving in a 3-bathroom house, we're probably leaving 15 rolls of toilet paper.
Yeah.
So
That's
they
generous.
go through that in 3 days. Yeah, it's very generous, but there are groups that'll go through it in 3 days.
Mm-hmm.
Well, I'm not going to go out and drop off a case of toilet paper for you to go through again. They tend to use it differently when they buy it.
Right. Sure.
They had an adequate supply at check-in.
Adequate
Yeah, I
supply
think
check-in.
adequate supply at check-in. Yeah.
Yeah. From a inspector sanitarian aspect, Trista, Craig, I don't think Emily's on. Do you see a misinterpretation of adequate supply from an inspector point of view?
It hasn't really come up. I mean, there has been tourist rooming house operators that would require people to bring their own linens.
Sure.
So I'm wondering if we should have some requirement for notifying the guest at the time of reservation, if they're gonna be required to do that.
To bring their own toilet paper?
Yeah, there's a reasonable amount there for the day, but if you're required to bring your own toilet paper, then you have to be notified of that. Same with the towels and stuff.
Sure.
That's not a bad idea.
Yeah. Anyone from industry that knows of situations like that where there's no, it's just bare bones, no toilet paper provided, and possibly ways of how they handle that?
I mean, I think this is Chrissy from the Dells. I think some of these non-traditional rentals are getting creative on ways that I don't think it's ways to try to get away from it. I think it's just they're saying like, if this is a remote camping experience, but that's not a tourist rooming house, you know what I mean?
Right.
I think most of those scenarios, at least from what we've seen, they're fairly upfront in saying, and the sites that are booking a lot of those give a way to be fairly clear about it. So I've not seen, at least, especially like northern Adams County with some of those, again, if you're staying in a ice fishing shanty for the weekend or something, they're pretty clear about what they provide and what they don't provide.
Sure.
I don't think anybody's trying to tell someone like, hey, we're not going to provide you toilet paper if we give you a bathroom. I know it seems kind of silly, but I've not seen anything in some of that would be the case.
It'll be the first thing that gets posted on the internet, I guarantee you.
Oh yeah, exactly.
If there's no toilet paper, yeah.
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 I think from an inspection point of view, we're going to be there doing the inspection when it's not being rented. And so if I am doing my inspection and I see that there is, not only toilet paper on the roll, but extra being provided, I'm going to look at that is that they have an adequate supply of toilet paper. Beyond that, if you're renting to a group that's going to be there for a week, I mean, it's common sense, whatever communication you have with that operator as far as what you're initially providing and what they may have to obtain during their stay. But I think from our point of view, when we do the inspection, we're looking to see that it is being supplied with toilet paper.
Yeah, and I'm not worried about you guys. I'm worried about, yes,
Right.
eventually someone will find the state code and they'll say, hey, by law, you guys are required to give us all the toilet paper we want. So that's where I'm coming at it from. I want it to be worded in a way that, it doesn't look like
Can't be taken advantage of.
no
Yeah.
governor on it. Yeah.
Yep. I get that.
Nope, I like the suggestion.
Okay. That was a good toilet paper discussion.
Hey, Ted, I got one thing,
go ahead.
before you move on.
Sure.
This is Jason, St. Clair County.
Yep.
Back up to your non-water waste. And I don't know if other counties have had this issue. So I'm looking at
391.
provision C.
Yep.
Right there. I'm not sure if other counties or other people are seeing, problems with these systems, but we are getting these creative individuals that are trying to do tourist rooming houses out of a yurt or some kind of a small little cabin. Do we want to have a hand washing requirement in here? And that we could also do it in the tourist rooming house section directly, that, we must have some kind of hand wash system, but I didn't know if it would be appropriate just to have a note of that right in that provision or not. So
Sure. So I know in the campground code, which is usually where the type of structures that you just described, your yurts or your cabins less than 400 square feet in area. In ATCP 79 in general, it does not require hand washing. I know for instance, if you go to a DNR state park and you're at the outhouse or the privy, you may have just a hand sanitizer, and that's it.
Right.
There isn't any plumbing provided in there. So I don't.
If they're getting a TRH license, they are going to be required to have one toilet, one sink located adjacent to the toilet room, which would be for hand washing, and a shower bathroom. So You know, if you're gonna have a yurt that meets building requirements to be considered a TRH, you are going to have a bathroom and a sink.
Right.
Unless we do something with
With the
the
specialty
specialty
lodging.
lodging, right?
Correct. That would get exempted then.
Okay, yeah, because that's gonna be the problem. I mean, most of our county regulations, for these non-water waste, and that we call them non-plumbing sanitary systems. So in order to even put one of these types of systems in, they cannot have any plumbing facilities within the building, because then we're asking, where's that water going? You
Yeah,
know,
they
and
need-
if
you
we've
need a
got this
post then.
outhouse, yeah, then they need a post. So anyway, it's
Yep.
just something to
Yep.
think about as we go farther forward, I guess. So,
Sure.
That's exactly the conversation that we're having with SPS, with Dispus right now regarding the specialty lodging, because those exact scenarios that you're describing is what would be encompassed in a specialty lodging type situation where they don't have a conventional system. What are they going to have? You know, one of those things would be you can't have plumbing, because if you have plumbing, then you're going to have to meet the basic plumbing requirements. So if
okay,
you have
sounds good.
something that, if that's remote, that isn't going to have plumbing, and people, you know, are looking for that type of experience where maybe they have an outhouse and a hand pump to get water, but there's no plumbing. And so you're not going to have, you know, if you want to cook, you're going to cook over an open fire. You're not going to have sinks or any type of plumbing in the facility.
Okay, yep. Sounds like you got it covered. So anyway,
I appreciate that. Thank you. Okay, we're gonna go on to, we still have 50 minutes, so I might as well carry on with this. I think there's only a page and a half left, so we could get through this too. 72.18 Building Structure and Safety. Number 1, Wisconsin Building Code, except as specified in this section, all buildings at a lodging facility shall comply with the applicable building codes as enforced by the Wisconsin Department of Safety and Professional Services or their agents. 2, slips, trips, and falls. All lodging facilities shall be operated and maintained with a strict regard to the public health and safety. Except as specified under paragraph C, lodging structures shall meet all of the following. A, handrails. At least one handrail shall be provided for a flight of stairs with more than 3 risers. 2, the height of the handrail shall be between 30 to 38 inches. B, guards. 1, guard shall be provided on all open sides of stairs consisting of more than 3 risers. 2, all elevated surfaces in interior and exterior areas of a lodging facility shall be provided with guards on all open sides that are elevated more than 30 inches above the floor or grade, including lofts, open sides of landings, platforms, decks, balconies, or porches that are a part of or attached to the lodging facility. 3, guard spacing must be equal to or less than 6 inches. 4, guard height shall be equal to or greater than 36 inches, except that guards may be less than 36 inches when terminating to the underside of a stair handrail under paragraph A2. C, exemptions. Requirements under paragraph A and B do not apply to window wells, egress wells, retaining walls, other landscaping features, or detached walkways or stairs, landings, platforms, decks, balconies, or porches that are not part of the lodging facility. Is that exemption clear enough? So basically what we're getting at is if you've got a long staircase down to the lake that's in the backyard, we're not looking at that for guards or handrails. Or if you've got other landscaping or retaining walls that would not require a 36-inch guarded platform on it. Seems to be okay. Okay. Number 3, sleeping rooms. A, spacing and number of occupants in a sleeping room. 1, beds shall be arranged to provide at least a 3-foot separation between bed frames for emergency egress. 2, the number of occupants per bed shall not exceed the following. A, no more than 1 occupant for a mattress width of 50 inches or less. B, no more than 2 occupants for a mattress width of more than 50 inches. 3, the number of individuals in a sleeping room shall not exceed the requirements established under sub D 1 and 2, or the posted occupancy limit established and enforced by the local government agency, whichever is less. So current way of determining sleeping room size is cubic airspace. So it's an individual 12 years or older gets 400 cubic feet, and someone younger than 12 is 200 cubic feet. So you would do the length, width, height of a bedroom and divide that by either 400 or 200 or a combination thereof to get the number of people that can sleep in there. This approach, I kind of fussed with a CAD program and tried to jam as many beds as I could in a fictitious bedroom, and this came out pretty close to the current standards for 400, 200. But I think it might be a little bit more finite on how many people you can actually keep in a room with this type of wording. So 50 or more inches is going to be like your queen or king bed. And then anything less is going to be your twins or singles. So how are people feeling about sleeping room size?
So what about a full-size bed?
I think that's less than the 50. There's probably 10 different mattress sizes. I think in the grand scheme of things, let me look up the typical full-size mattress.
Yeah, I think a full-size is bigger, at least 50.
I think it's 54 or 56.
Yeah, I think that's right.
53 by 75 is what I have. A queen is 60 by 80. So a full would be 2 occupants.
Hey, Ted, this is Jason again.
Sure.
I would, maybe we can throw another thing in there, because some of our local zoning stuff, folks are doing 2 per bedroom or 2 per bedroom plus 2. So I think you can leave local governmental agency, but maybe, occupancy limit established and enforced by, their sanitary system and or local governmental agency. So I'm trying to just put in there about the sanitary sizing.
Yeah, but I think the sanitary sizing issue is going to be coming to contest in great volume here. That's going to be one of the biggest things that's going to be there at a state level, going to court on this, just because it's, again, based on, it's not based on science. So that's something that's going to be, I would be careful to put that, thank you, put that into this code, because if that gets reversed.
Yep, I think by saying local governmental agency, then they're dealing with that
Ordinance
through whatever their local requirements are.
Yeah, but if you put in there based on pot size.
Yeah, I don't want, I'm not in favor of that as well.
I agree.
Yeah.
Yeah, that's kind of where we, like, as Jim was just saying, if you're doing the 2 per bedroom in that municipality as part of their ordinance, then that's enforced by that local government agency. I don't want, and we can't have, non-agent health departments enforcing local ordinances using 72. That's not the intent of our ability to be in there and doing the inspection. So, but we also didn't want to step on toes. If there's something locally enforced, then
Good.
whichever is the least of that, the limiting factor, that's what takes the cake in that particular jurisdiction. So
And, and for us as inspectors, it's more just getting a general idea of how many people can stay in that tourist rooming house, and that I don't go online and see that they're offering it to rent for up to 20 people when they could only have 10, based upon the size of the room and how many beds they can have in there with how many people. So it gives us basically an opportunity to have a conversation with the operator that says you can't say that on your advertising.
The 2 people per bedroom, that is in SPS 383, so that is in the administrative code for it. It's not, and that I said a lot of local governmental units have their own provisions, but that's one of the things on the enforcement side from the zoning perspective is it's very confusing because, I mean, I've had tourist rooming houses with 43 beds in them. And so, I mean, 1 person per bed, that's 43 people, but their sanitary system wasn't sized appropriately, you know, so it's always a conflict that public health and zoning runs into, so.
Yeah,
We-
but
we
the 2 people per bedroom isn't specific to a tourist rooming house. The state code for POTS just simply states 2 people per bedroom. That would be for everybody. So that's where it's going to get contested, that if you're going to enforce it for a tourist rooming house that might be booked for 60 days a year, and you have someone at a lake house that owns it and has people there all the time, and they've got 30 people coming and staying there all summer long, even though it's not a tourist rooming house, they're putting more demand on their septic system than someone who's not. So
Agreed.
The issue is, the issue is that we've taken away all science. The counties are now saying that it's not going to be based on usage. You can't put metering systems in to prove that you're not using more than someone else. So again, it has nothing to do with usage. This is a control issue. And I have numerous county officials that have already told me that this has nothing to do with septic health. It's about getting the large capacity tourist rooming houses under control.
Ted, we do have
Anyway, I don't wanna get
language
off
to,
topic.
we do have language to deal with the failed septic, right?
yes,
To alleviate a health concern.
correct. Yeah,
Right.
if
And
it
I've
got
talked
pushed
to-
to that saturation, yeah.
Yeah, I've talked to 30 different septic companies around Wisconsin to ask them if any of them have ever had a call from a tourist rooming house for a failed septic. I know that's not a complete interview with the state, but it's a good start. And I've not found one company that's called for a failed septic system in a tourist rooming house. And what they're all telling me is that if it fails, it's going to back up into the house. Your showers and your floor drains are going to start to bring in human sewage. So it's not about groundwater. It's not about your neighbors. It's not about anything else. So again, anyway, I don't want to get off topic. We'll talk about that at some point.
No, that's fine. I do appreciate the viewpoints here. And again, I know it's a contested topic. And that's why we wanted to put in that enforced by local government agency. If that's the law of the land in a particular municipality, and that's more strict than what we have proposed here, then that's the municipality's responsibility to enforce their ordinance. So we again, we didn't want to step on toes, but we also wanted to change our determination of a sleeping room from that 400, 200 cubic feet to something, I don't know, I feel like it's a bit more tangible because you don't know who's coming in and using that bedroom at any given time. That has a lot of flux to it, whether it's someone less than 12 or over 12. I think this is a bit more measurable.
Yep.
Yeah. So, okay. I do
Is
appreciate the
this-
feedback. Yes, go ahead, Craig.
3-foot separation between the bed frames, is that intended to mean at the foot or the head of the bed? So if you have a kind of a narrow bedroom and you have the foot part of the frame lined up right next
Yeah,
to each other.
I think the idea would be a 3-foot
side to side.
Just kind of all around, really, bed frame to bed frame. So whether that's head to foot, side to side, foot to side, head to side, any way around that, you have a 3 foot cushion.
So I have some narrow rooms where there's kind of like a hall space on one side of the bed, and then the beds are all lined up, in a linear fashion rather than on opposite walls.
Yeah, I see what
So
you're saying.
this
I have a
isn't
custom-
intended to be like the rec ed camp code where we're trying to
No,
keep a separation for communicating disease.
no, because they're going to be communicating in the kitchen and everywhere else. The group
So
of people are going to be renting
what
it
is the-
together anyways.
What is the 3-foot radius
So th-
or, buffer
three-
going
the-
to stay? Because like
Finish. No, go ahead. The intent of the 3 foot was to allow people to get out of the bed and navigate through that room and out of the room in case of an emergency. So
right, so I have like a custom loft in a room that has twin beds elevated, and they're foot to foot with about 1.5 to 2 feet between each of the beds, but there's about 6 feet of open space in the room to the outside of that.
okay,
That's not going to be an issue.
no, it's an issue with the way it's written right now. So we may have to change. I get what you're saying. I can visualize what you're saying, and maybe Craig,
Yeah.
that's kind of what you were getting at too.
So that's a good description of what I was getting at.
Yeah, and
Right.
Dave, your point is you can get out of bed. You've got 6 feet of egress to move, but it just so happens that the foot and the head are within that 3 feet. So,
Right.
yep. No, we don't want to prohibit that, but the way it's written right now,
Yeah,
that
so-
is needs to be fixed.
Ted, could it be or other configuration allows for maximum ability for egress?
Similar to our variance.
Yeah,
Yeah.
or other approved configuration.
I think there's a way that we can word it to not exclude the linear.
Right.
Yep.
That's our intent.
Yep.
Was that if you had, a bed on one wall and a bed on another wall, we would expect that there at least be a 3-foot separation widthwise there, not necessarily linear, because you'd still have that open space like it was suggested.
Mm-hmm.
We just have to figure out the right way to say it.
Mm-hmm. All right. Thank you, Dave and Craig, for the real world examples there.
Is there a requirement to have beds for a sleeping room?
No, not necessarily. Are you thinking like the air mattresses and cots?
Yeah, I mean, people bring a cot along or, have your
Did-
kids
Then we
set up a
define
sleeping
bed
area.
We did define bed. Yeah.
could be an air mattress.
Yeah. Let me see what we define bed as. I believe it's the same thing as in the Rec Ed code, but it means a piece of furniture for sleep or rest, including a framework with a mattress and coverings, cot, bunk bed, futon, sleeper sofa, sleeping pad, or air mattress placed on the floor. So we have for bed.
So same thing would apply, you can't throw 20 air mattresses in there. If you're going to have air mattresses, you're going to still have to have the spacing for emergency egress. And your occupancy is still going to be based upon, the width of that air mattress.
Right. For your particular room.
Yep.
I guess I'm thinking in terms of occupancy, if you're gonna fill the living room with cots or air mattresses on the floor. Do we have any problem with doing that? You know, so you've got some beds in the actual bedrooms, but then
Right.
filling the rest of the house up in the living room and whatever room.
Yeah, I don't doubt that that happens.
Ted, is there
in
a sleeping
some
room
places.
definition versus a common area?
It's the room where sleeping happens.
Should there be a sleeping room definition?
I'm kind of torn on that because rooms get repurposed. You know, I have a 3-bedroom home, but only one is used as a bedroom. The other 2 are home offices. So in my house, it's really only 1 bedroom. There's only 1 sleeping room. You know, yeah, people aren't using their dining rooms anymore. Those are turning into different uses. So what traditionally is a 3-bedroom on the realtors list, I don't know if truly that's how it's being used.
And you're gonna have some people that'll have a sofa sleeper in their living room that can be that could be
Okay.
pulled out. And
Yeah.
you know, again, I think it is, you know, what the person is indicating to us is going to be used for sleeping. And what actually happens when it's being rented, we're not going to have any regulatory purview over that. That would be more something at the local level if they got a complaint about something that they would investigate, and if it's exceeding what they've established as their occupancy, you know, then dealing with it that way. But otherwise, we're not really, you know, we're basing this on that this is what the operator is telling us. This is what we've configured based on their spacing and beds, and how is that compared to what they're actually advertising for on the internet, and does that align? That's about as much as the inspectors are going to be able to do. The complaints that may come into the municipality or the county, you know, then that's something that zoning or the police are going to be following up on.
Okay. So we will make changes to the 3-foot based on Dave and Craig's input on spacing and number of occupants. Carrying on with sleeping room, we're looking at B, ceiling height. Except as specified under subdivision 2 and 3, every sleeping room shall have a minimum ceiling height of 7 feet. 2, sleeping rooms may have ceiling heights of less than 7 feet, provided at least 50% of the room's floor area has a ceiling height of at least 7 feet. Any area with a ceiling height of less than 5 feet may be ignored in this calculation. 3, bed placement shall afford the occupant with maximum ceiling height clearance for emergency egress. C, bunk beds. If a bunk bed is provided in a lodging facility, the operator shall ensure all of the following requirements are met. 1, no more than 2 bunk beds or no more than 2 beds may be stacked vertically. 2, there shall be a vertical separation of at least 2.5 feet measured from the top of the lower mattress to the bottom of the frame of the upper bed. 3, a free space of at least 2.5 feet shall be provided above the mattress of the upper bed. 4, bunk beds shall be located away from potential hazards, including heat sources, ceiling fans, or other ceiling protrusions. 5, the upper bunk shall be provided with guards and shall meet all of the following. A, the top of the guard shall be at least 5 inches above the top of the mattress. B, the bottom of the guard shall be no more than 3.5 inches above the top of the bed frame. So this was a copy and paste from what's in current, just passed for the Rec Ed Camp Code concerning bunk beds. That's why these have the P and PF superscript on them. Any feedback on bunk bed language? Okay, any final thoughts on what we covered today? So that goes back to the plumbing, outs, waterborne diseases, testing of water, and then our slips, trips, and falls, ceiling height, and sleeping rooms.
Did we cover, sorry, this is Trista,
Uh-huh.
anything regarding, like illegal sleeping rooms in a basement that don't have proper egress?
Egress is going to be, that'll be covered on next meeting.
Okay.
But it's part of, we're taking the same language which was adapted from building codes for assessing a sleeping room. So whether it is in a basement, first floor, second floor, or above the second floor, there is a prescribed manner in which people need to get out of there. And that kind of goes back to Reed, in your mention of defining a bedroom, or what traditionally is a bedroom. People have been redoing their basements, and then all of a sudden you've got sleeping quarters that were built in there that, when originally built, is not what it was intended for, but now they have a sleeping room in there. And which is fine, but we want to make sure, like Trista was saying, that these people are getting out of those rooms safely, and they have more than one exit. So they're not going to be trapped down there if that one happens to be blocked. So that will be covered in the next meeting.
Perfect. I have one more question.
Sure.
So on the website, a DATCP website for public meetings,
Yep.
for this meeting in particular, it has a spot for meeting documents. Is that something that we're supposed to be able to click on and obtain, like a version of this, what we're working on today?
No, it does have that. But all that's required to be posted is the agenda. If you want all of these materials ahead of the meeting, I can attach it to the meeting notice each month. Would that be of convenience?
I would find it helpful.
Okay.
Sorry, Amy.
Yeah, no, I agree. This is Amy. Just that we can read through them so we
Sure.
can like gather our thoughts.
Yep. Yeah, I can do that. I'll do that.
Yeah, that would be great. Because I know when we were talking the last meeting about the definitions for TRHs and stuff, I was kind of overwhelmed.
Sure.
Because obviously we have so many different setups here in Wisconsin. It's kind of hard to comprehend everything that we're trying to accomplish here. So
Sure.
yeah, that would be helpful.
Yep, I will do that. And then anything that we have covered is on that DATCP website. Just as a refresher on how to get there, programs and services, food and recreational facilities. Either one of them will take you hotel or motel or tourist rooming house. It's along the right side. So everything that we've covered thus far, I try to have put up there by a week from today. So the Tuesday following the meeting, everything that we covered is going to be here. And on our meeting notice, I will attach the materials that we'll be going through. So you'll get probably a duplicate email each month, but on there you'll have the information that we'll be working on. So thank you for that. Anything else before we depart here?
And feel free, just because we covered it doesn't mean you can't provide comments.
Right.
We take any and all comments. So if there's something that you're reviewing from before that you have a question or a comment on, it's not too late to provide it to us.
Okay, with that, I think we'll adjourn here at 2:40, and we will meet again in the last Tuesday of March.
Thanks, Ted.
Thanks,
Okay,
Ted.
you're welcome. Have a good day.
Thank you.
Yep.
Bye.
Thank you.
Bye.
Thanks, everyone.
Thank you.
Bye.
Thanks all. Bye bye.
Thank you.